call this meeting to order at 6 o'clock p.m. Roll call, please.
Director Birdboy?
Here.
Director Bigstown?
Here.
Director Menard?
Here.
Director Proctor?
Here.
Director Berker?
Here.
Director Valdez?
Here.
Director Garcia?
Here.
Would everybody please stand for the Pledge of Allegiance, please? Ready, begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Consider approval of the agenda. In the case of an emergency, items may be added to the agenda by a majority vote of the board of directors. An emergency is defined as a work stoppage, a crippling disaster, or other activity that severely imperils public health or safety, or both. Items on the agenda may be taken out of sequential order as their priority is determined by the board of directors. The board may take action on any item appearing on the agenda. Do you have anything to add?
Yes, Madam Chair. Pursuant to Government Code Section 54954.2, I have a recommendation for the Board of Directors to add an item to the agenda to in whatever order you determine would be appropriate. My recommendation would be for after public comment, in the event that there's folks here who want to give public comment and then leave, but prior to the consent calendar. So I recommend adding an item between item 5 and 6. The board would have to make a 2/3 determination of all members present, that there is a need to take immediate action, and that the need for action came to the attention of the local agency subsequent to the agenda being posted. The agenda item would be a closed session pursuant to Government Code Section 54956.9, paragraph D1, conference with legal counsel existing litigation. We were presented today with Superior Court of California, County of Imperial, case number ECU 003473, which is Pioneers Memorial Healthcare District versus Imperial Valley Healthcare District, all of the Imperial Valley Healthcare District directors in their official capacity, and other folks. Since we were served with this, well, not served, but we were presented with this petition for writ of mandate, which was filed yesterday, it was brought to our attention after the agenda posting, but I believe there is a need to discuss and take immediate action. So I'd advise the board to break into closed session to discuss.
Okay. Do you have a motion to make the adjustments to the agenda?
I second.
Second. I have a motion by Goodsell and a second by Berker. All in favor say aye.
Aye.
Any opposed? Any abstentions? Motion carries. So at this time, we'll move on to public comments. At this time, the board will hear comments on any agenda item and any item not on this agenda. If any person wishes to be heard, he or she shall stand, address the president, identify self, and state the subject for the comment. Time limit for each speaker is 3 minutes total, not 3 minutes per item, but rather 3 minutes per speaker for all items on the agenda. A total of 15 minutes shall be allocated for each item for all members of the public. The board may find it necessary to limit the total time allowable for all public comments on items not appearing on the agenda at any one meeting to 1 hour. Do we have anybody here that would like to make a public comment?
Good evening, my name is John Grass, and I want to first thank the board for publishing the video recordings of past meetings on the 22nd and March 14th. Thank you on your website. These recordings are really an important public resource. The IVHD is a steward of public trust and must have the opportunity to be heard as you reshape the county's health care for decades to come. The IVHD is still in its infancy. Its communication efforts need significant work. Currently, comments, questions submitted on the website have gone unanswered. Perhaps most concerning is the email on the website doesn't work and results in undelivered messages. It would be reasonable for the board members to have their own IVHD email address or that contact information for the IVHD chief administrative officer or clerk to be provided on the website, along with instructions for submitting public comment to the board. Finally, we again request that all documents provided to and discussed among board members to be provided to the public via the website as part of the agenda packet. Missing from tonight's agenda packet posted on the website are the documents related to item 8E, a review of Heffernan and IVHD financial statements. These should be provided in the agenda packet to the board and to the public in advance, not merely as indicated under item 11C. Thank you.
Thank you. Do we have any other public comments?
Good evening, members of the board and audience. This morning I went to the election department to review the 700 forms that you all have to complete. I was told they weren't available due to technical difficulties that they were having. They're going from paper to online. Understood and accepted, but I have a question, and I'm going to direct it specifically to one of your board members. Mrs. Berker, I've been observing the meetings that you have some pointed questions. My finding, and correct me if I'm wrong doing this, I understand you are a member of the PMH board?
I know.
And you're also a member of this current board, but you have a business that does business with PMH?
Sorry, I advise the board not to interact with the public. It's
Okay.
public comment.
Okay, well, that was my comment. I understand we can reserve for comment on the written mandate later?
Correct. You use that.
Okay, thank you.
Great. About a minute at a time.
Do we have any other public comments? Seeing none, do I have a motion to move into closed session?
I second it.
I have a motion by Goodson, 2 seconds.
What's your profit figure?
And a second by Proctor. All in favor, say aye.
Aye.
Any opposed? Any abstentions? With that, I'll move to closed session. Call this meeting back to order at 7 o'clock. Huh?
Would you like me to give the closed session report?
Yes.
There were no reportable actions taken during the closed session.
Thank you. We'll now move on to the consent calendar. Any member of the board, staff, or public may request that items for the consent calendar be removed for discussion. Items so removed shall be acted on separately immediately following approval of the remaining items on the consent calendar. Do you have a motion or approval for the approval of the consent calendar? There is no consent calendar. We'll move on to item 7, board member comments. Reports on meeting and events attended by directors. Do any of the board directors have any comments? No? Seeing none, we'll move on to item 8, discussion and/or action items. Item A, discussion and possible approval of directors and officers' insurance.
So I'd like to pose a question. I still haven't received any financial.
Can you present this item first,
Oh,
please?
go ahead. Sorry.
Well, so we reached out to Beta and for DNO coverage and general liability, and this is the quote for the DNO coverage. And I believe this are the limits that they recommended, and I believe they're acceptable. And so the prorated contribution will be $7,500, and obviously that's the annual contribution is $10,000, but they're prorated because we're at the year, so it's $7,500 to cover the board. And this is for the director and officer coverage.
Do you have a motion or approval for the approval of the consent calendar?
And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the consent calendar. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer coverage. And this is for the director and officer co So, we're going to see the DNO and the general liability is a separate one. So this one is for the indemnity defense, for the coverage for zero on each wrongful act for insured persons who not get reimbursed. 25,000 for each wrongful act with the entity reimburses the insured person, 25,000 each claim, including defense expenses. And then obviously there's the liability limit for $3 million per occurrence and $3 million aggregate. And that's the fee for the DNO coverage.
Do you have any questions from the board?
And I have one, and I don't know if you can hear me or not. But I'm noticing that this defense expenses are paid within the limits of the liability, not outside of the limits.
No, I don't understand the question.
Well, the question is that if defense expenses are paid within the limits of liability, that means that $3 million per occurrence of the $3 million aggregate can get eaten up by attorney fees to defend it. So if we lose, then we don't have any limit left to pay. There are policies that have the defense outside of the limit. I mean, it's probably more expensive, but I just figured I might bring that up. So if your defense expenses are paid within the limits of liability, that chunks down your per occurrence, which is the same aggregate. So I don't know if that's what we want or not. Just
So, I mean, I don't know if this answers your question, but the way I read that is the limit to what insurance would pay towards a claim is $3 million. And part of that $3 million includes the legal fees necessary to defend the claim. So, yes, if the claim ends up being for $3 million and you've got $500,000 in legal fees, you'd only be able to pay $2.5 million. And then the other $500K would come out of the pocket of the district, yeah.
So I guess my question is whether or not we had, and I understand this is because we're like piggybacking on with what Heffernan already had, is that
No, this
correct?
was a special quote designed for us.
Okay. If there was a way to get a quote where the defense expenses are outside of the limit. I mean, I know it would be more expensive, but
We can go back to them and ask for another option. I know there was a higher one, and they felt, their recommendation was that once you begin dissolving the hospitals, that would be the time, but doesn't mean that we can ask now. So definitely I could go back to them and ask for a new quote and bring it back to our next meeting.
I mean, I'm just wanting to point that out so everybody understands that, you know, what she just explained is that the defense cost, which 9 times out of 10, the cost to defend yourself is what your expense is. But, you know, if you win, woo-hoo, but if you don't and you still have to pay out, then your limit has now been chunked down by your cost to defend yourself. So,
Your potential settlement limit.
yeah.
Do you think that we need more insurance? Like, I mean, right now we don't really have any assets, and I think our insurance would change, you know, as we get more
I
assets.
would say we're probably okay for now, but I just feel like, I mean, for those of you out there, I am an insurance agent, so I feel like I have to do my due diligence in pointing this out to the board, because I would never recommend that one of my clients get a policy that have the defense expenses within the limits of liability unless there wasn't anything else available. So I just feel like I have to say that. But $3 million per occurrence is the same as the $3 million aggregate. So, you know, if you have $1 million things in a year, you have the whole $3 million. But just be aware that your cost to defend yourself is going to tick away at that $3 million limit. So,
I also would like to point out that this policy is only from now until July 1, 2024, and then it's time to review it again, at which time you could increase it. Yeah,
renegotiate.
renegotiate it, or we could bring it back until you choose.
It might be a better approach to just take this policy for what it is now, and then in July or June, when we start needing to renew it, do it,
Relook at it.
relook at it.
And also just a disclaimer too, I have no affiliation whatsoever with this company in any way, shape, or form, just to be clear, so.
Do you have any other questions from the board?
I have a question about finances.
The item is on item E.
Okay.
So this is, that was the item for,
Do you have a motion? On item A? Do you have a motion?
The consideration would be whether or not to approve the proposed D&O insurance.
I make a motion to approve the proposed insurance coverage.
Second motion.
I have a motion by Garcia and a second by Medart. All in favor, say aye.
Aye.
Any opposed? Any abstention? Motion carries. We'll move on to item B, discussion and possible approval of general liability insurance.
general liability, same term as the one for DNL. So it's good from the time we call them to July 1. And it's the same $1 million per occurrence, including an aggregate. All defense expenses are paid outside of the per occurrence limits. All sub-limits are subject to the per occurrence and aggregate limits. And this one is prorated at $2,500 for what's left over the fiscal year.
Do you have any questions or comments from the board? Do you have a motion?
I move that we approve it.
Second?
I'll second.
I have a motion by Proctor and a second by Garcia. All in favor, say aye.
Aye.
Any opposed? Any abstentions? Item carries. Moving on to item C, discussion and possible approval of district bylaws.
I'll take that one, Madam Chair. So attached to the agenda packet are some draft bylaws that we drafted for the board's consideration. They're included in the agenda packet, and I'm just gonna kind of go through them high level, but if there's any questions from the board, please let me know. There's a preamble which invokes the 8918. There's the scope of the bylaws, and the purpose of the scope is to set forth what will be governed by this board and the rules of this board. So this is not the medical staff bylaws. You don't have a medical staff yet, but at some point in time, if you do have a medical staff, you would adapt medical staff bylaws to run those med staff operations. So a lot of these bylaws follow either Robert's Rules or the Brown Act, with a little tilt for healthcare districts. So the purposes are listed in section 2. Profit and gain, this is a public healthcare district, so there's no contemplation of profit or pecuniary gain, although that doesn't prevent you from having profit and utilizing it consistent with the powers. Disposition of surplus property, that's just in there because it should be in there, but you don't have any property yet. At some point, we'll have to designate a mailing address and official offices for IVHD, but I left that blank since we haven't made a determination and we don't have a building yet. At some point, we'll come back and that'll be a simple amendment to the bylaws. So the number of qualifications, elections, or appointments section follows the language of AB 918. The term, this also follows AB 918. This board at some point in time in the next couple months will have to decide on the staggered board of directors and choose a number of board members to remain on this board for the next election cycle, in which will cycle off. But each member of the board so by the conclusion of the 28th election, all 7 board members will be elected officials and your terms will be 4 years. The powers and duties, you have all the powers and duties listed therein, which are consistent with those listed in the local healthcare district law. There are some duties that I want to bring your attention to as the board. On page 7, the duty of care, the duty of loyalty, and the duty of obedience, which basically means you have to exercise proper diligence in your decision making and act in the best interest of the district. The duty of loyalty means basically you can't have conflicts or be personally or politically compromised. And the duty of obedience just means you have to be faithful to the purposes of the district that are described earlier in the bylaws. There is a compensation section, which is consistent with the strict letter of the Health and Safety Code. You'll notice on today's agenda, there is not a business expense reimbursement policy or a board member compensation policy because we don't have funds yet expressly for that. That's later in the agenda for discussion. There are some provisions here about how vacancies, resignations, and absences for meetings should be handled. All of those can be changed if you have a different wish on how that is to be, how that should be prescribed. Some of it is governed by statute, some of it is not, and is a little more flexible. Regular meetings, of course, this board has already dictated that second Thursday of each calendar month at 6 p.m. will be a regular board meetings. Special meetings follow the provisions of the Brown Act. Quorum is a majority of the board and is required in order to take action. There's some provisions in adjournment which also follow the Brown Act. Setting the agenda is something that has some wiggle room too, but here we follow the Brown Act with respect to the agenda setting deadlines. Some boards want agendas circulated more than 72 hours ahead of time. We've invoked the ADA, which is required by law for folks with disabilities that want to attend board meetings. The agenda development, there's a paragraph on that and how the agenda is developed. Generally, it's by the chair, the chief staff person, and legal. And then how to add items to the agenda is put forth in this paragraph too. Generally, it's the chair that sets the agenda with legal and the chief staff person. And then if members of the board want to add items to the agenda, that process is dictated kind of herein. Some, for example, want to require 2 board members in order to add an item to the agenda. Some are okay with just one. This one contemplates that any board member can ask for an agenda item to be placed on the agenda. The rules of order invokes Robert's rules, conflicts of interest, and you'll note we have a conflict of interest policy in the pipeline here on the agenda. And then officers, I took the liberty of, I think you're labeled as kind of president instead of chairperson. And because at some point you will have a CEO or maybe a president of the hospital, I took it upon myself to change that to chairperson of the board, but you can change that. That's just kind of what I called it. And then the vice chair, secretary, and treasurer. There's some reserved sections if and when we get up and running and have a lot of business. It generally ends up being beneficial to have an assistant secretary and assistant treasurer to assist the board members elected to those positions to do the kind of administrative tasks. Provisions about removal, resignation, and vacancy. And then determinations of and sanctions for willful or corrupt misconduct in office. Sections to read closely that are an administrative process laid out in the event that there's any accusations by board members against other board members, which we hope will never happen. But if it does happen, at least we have a process in place that's transparent and clear so folks know what to expect. Committees starts on page 18. We don't have any committees right now, but I have added a couple of sort of holder committees that are typical of healthcare districts at the bottom of page 18. So for example, a finance committee, a governance and ledge committee, an audit, compliance, and ethics committee. I don't think any of those committees are necessary at this point in time, but I think that they're good placeholders. And at some point, if and when they are formed, they will have to have standing meetings that will be subject to the Brown Act. There's a section on ad hoc committees, duties of management officials, which is the CEO, the clerk of the board, chief compliance officer, when you have a hospital to run, and then provisions about your eventual CEO's evaluation. So all of these are, I recommend them because they're placeholders for now, even though you don't have these staff persons, you don't have a medical staff, so that you can be ahead of the game instead of behind it for when you do have a medical staff and a CEO. And then if there's any provisions in here that you end up thinking, this isn't quite right for us, we can always bring back these bylaws and amend them. The last sections are really miscellaneous. It's about how to formalize title to property. You can decide on a seal if and when you want to. And then a provision that requires the annual review of bylaws to make sure that they still make sense every year. And that's about it. So these are kind of bare bones and as applicable as possible as I thought would pertain to this organization at this point in time. And we can make them more sophisticated with time because they can always grow. But it's better to have some bylaws in place so that you have a process than to not have bylaws in place. So they're here presented. I'm happy to answer any questions, but they're presented for your consideration and possible approval.
Do you have any questions from the board?
I do. So with regard to the management officials, in some of the ratings I've conducted, there's also a position as COO.
Yep.
So it's not on here. So is that something we can explore as well?
Yes, so at some point in time, you can decide whether or not this board wants to be responsible for the appointment of the COO. Sometimes the CEO appoints the COO and works under the CEO's umbrella. And if so, they don't belong in here. But if the board is going to be appointing these are positions that the board hires or designates. And so if the COO is a position the board feels is appropriate to hire directly, is a direct report, then yes, they belong on this, in the bylaws. However, if the COO is going to be an employee that is brought on by the CEO, then they do not belong in here. So it's really at the board's discretion.
So the same thing applies to like the chief nursing officer thing?
And the CFO.
And the CFO.
Mm-hmm. Yes.
That's all I have.
Do you have any more questions or a motion?
Make a motion to approve. I'll second.
I have a motion second. All in favor, say aye.
Aye.
Any opposed? Any abstentions? Motion carries.
I do recommend the board add this. I will add to the public finder too, this to the back of your handy binder so that you always have your bylaws.
Thank you. We're moving on to item D, discussion and possible approval of conflict of interest policy.
So there are two things that this board will eventually have to approve. One will be a conflict of interest code, and the other will be a conflict of interest policy. So this is the policy, and the reason the code isn't presented here is because you don't have staff yet. So conflict of interest code is required by the Political Reform Act. The Political Reform Act on its own, even without a code, already requires this board as elected or as appointed public officials to file Form 700s within 30 days of assuming your office, and that dictates the filing of the Form 700s. When you have staff and counsel and consultants who are going to be making determinations regarding public funds, so who are going to be making the decisions of the agency, like your CEO, or making direct recommendations about what this board should approve in terms of funding or money, those folks will be listed on a conflict of interest code with disclosure categories about what they have to disclose in their Form 700s for the purposes of transparency for the public. Because you don't have staff, I thought about bringing a conflict of interest code, but it doesn't really make sense yet because I don't know what you want to call folks, and what you call them is very important because if you have CEO and you decided to call it president, you would have to amend the code, and it's kind of a pain in the butt. So I figured we would get a conflict of interest policy up and running first. So what this policy does, a lot of really, I would hope intuitive stuff, but it is stuff about, personal, financial, or other competing interest conflicts, potential nepotism, individual financial gain, and making sure that the policy accurately reflects the law, the legal requirements to avoid conflicts of interest pursuant to the Political Reform Act and Government Code 1090. So this just says, generally that these are public funds and you have to avoid all transactions, arrangements, or decisions that may give rise to personal conflicts of interest or personal gain. There's some examples that I find handy. about, spouses or other folks, and decisions that you might have to make and when a conflict could present. And then there's the procedures and an attestation. So on the back, there's an attestation that each board member would have to read upon becoming a board member within 60 days of appointment or election. And it's basically your personal attestation that you've read this policy, you understand the significance of the policy, and that you won't engage in conduct that could be a violation of the policy. And this is more administrative because there's criminal and civil liabilities for conflicts of interest outside of this policy. But this is just an easy way of having some public assurance and internal transparency with respect to what is a conflict and when you're, and signing an attestation that you agree with these basic concepts.
Do you have any questions from the board?
Should this also have a scope attached to it?
It could, but the scope is like all decisions of this board. So any decision that comes to this board, this policy would apply to that. So,
I mean the scope as to who this policy applies to.
oh, I see what you mean. Sure, I can add that. I'm happy to add that. This is generally would apply only to the board of directors and your chief executive officials. So yes, I can add a scope section that delineates that.
I would make the motion to approve this with, or all of it.
Yeah, no.
As amended, sure.
Yeah, as amended, only to have that scope there, so it's known on beforehand.
Okay.
Go second.
I second it.
I have a motion by Medard Jr. and a second by Proctor. All in favor, say aye.
Aye.
Any opposed? Any abstentions? Seeing none, motion carries. We'll move on to item E, review of Heffernan and IVHD financial statements.
We prepared for your package and added the full last year review, which is the audit that we do every year. And this is the current status of Heffernan's, the latest profit and loss report. Short story is, let's see, this is the full audit. And the audit was approved by the auditor, that it was done according to the GAAP rules, et cetera. And when we're looking at our total assets, this is before we started the urgent care. After the urgent care, we had a position of about 2 months. Sorry.
I can't hear you. Yeah.
Sorry.
And also, this is 2023?
The latest audit is 2023, but we also have the current financial statements.
Okay.
So the audit is pretty lengthy. Pretty much it talks about our financial position throughout the year and whether we did our accounting in the proper way. And that was done. And we can go directly to the section that has the conclusions from the study. And that's done every year, and usually we're a year behind, just so you know. That was part of the packet. You will note that traditionally, Heffernan Memorial Healthcare District provided a lot of grant programs, up to $750,000, $500,000 every year. During the last year, they focused on urgent care, which is about completed. We've had a lot of issues with delays that were outside of our control. The urgent care is going to be ready hopefully by July 1, August 1. And that's where a lot of funds went. And for this year, a lot of the strategic plan in the budget, which is going to happen in the next couple of weeks. Also the funds, we didn't do any grants because everybody's focusing on what IVHD is going to do. So that's why you saw a reduction in grants for this year. You're not going to see any grants. So that's the reason. So, I'm sorry, but here's going to
So who does it say in here who was awarded those grants by Heffernan?
Yeah, the only one grant that would be on this one would be the grant that's in progress right now, which is the grant for, what's the grant called? The Sure Hotline, the Sure Health Helpline. Yeah, they got a grant for $25,000. That's the current grant that they have. In the previous years, 2 years ago, they gave a grant to the group that's going to be starting the urgent care, and that was for so they could get started with training staff, etc. but we haven't done, there's, on the current budget, they've only talked about financial, for scholarships for students that are gonna go into the healthcare field. And it was proposed to budget $44,000 for people going to the field. Nothing else has been discussed about grants or any other programs because we're waiting to see what we're gonna do as a new district. Anyway, so what you can see here is that the last time that there was that we discussed grants, this is from the previous year. So moving forward, there are no grants, and the conclusion was that the study was done according to the gap rules, and that everything was there was no issue with the financial audit.
There's no findings at all.
No, they pretty much said, look, what we recommend is that when you spend money that you write on the receipts, who and who partook and what was the need about, and that was the only recommendation.
Could you talk to me more about that clinic that's been in the works for a couple of years, and where are we in?
Very good, sir.
And what money have they been spent on that already, and why didn't it finish?
Very good point. So this is the building located at 400 Mary Avenue in Calexico. It's right next to the neighborhood house in Calexico and right next to the fire department, the police station. This building was a building that was purchased by the district several years ago, and it used to be a dental office and an architect office. At some point, a Central Regional partnered with Heffernan, and they were going to provide services at that site, but there were a lot of issues with the plumbing. Nothing was done. During Heffernan Memorial Healthcare District's strategic plan and their business plan for 5 years, they discussed about what was the greatest need in Calexico. At some point, they discussed urgent care, community clinic, healthcare education, and a couple of years ago, 2-3 years ago, they decided that what Calexico needed most is they don't have an ER. And having standalone ERs that's not something that we can do, that they would need an urgent care. So the district budget for the urgent care. And the construction of what initially was going to be a resource center and classrooms that were in a partnership with IVC, we changed direction and went into the urgent care. Right now, that site got enlarged into about 7,700 square feet. There's been a lot of challenges because what happened in the last 3 years with the end of COVID and everything that was going on, there was issues that were unforeseen when the construction started, such as issues with the ducting, issues with the roof, issues underground. So that building pretty much had to get redone from the ground up, and it was on remodel only. The initial budget for the initial project was about $2.5 million.
Did that occur because there were no inspections then? I mean, if you're building a facility, you're going to have permits, you're going to have inspectors coming out and approving different phases of the structure, right?
That is correct, but when they bought that building, there was no blueprints for that building. So when they first came and when they responded to the bid for the actual project, there was a lot of findings that were not known at the time that came known when they started doing the remodel. Because that building's a remodel, the option was, do you want to do this urgent care from scratch, knock it down and start over? Well, we were advised otherwise because of cost. And the most economical, more efficient way to do it was to remodel the building that it was. And we did an RFP, Sanders Inc. did the design, and Mitchell Builders got the contract. And there was also later when as the building started talking about deadlines, we wanted to know what we can do with this building as far as an urgent care. We're given 3 options by the legal team. Number 1, that building could be owned and operated by Heffernan Memorial Healthcare District. That building could be, Heffernan Memorial could be the landlord, just build it and lease it out, or it could become a community clinic. Because of the realities of Heffernan not having experience in an urgent care or managing it, and the fact that a community clinic would not be sustainable with the model, we went with the model of doing the urgent care and doing RFP out for providing urgent care services. So we went and looked for an operator with experience of doing urgent care, and that's what their specialty was, not something else. In the valley, we looked around and there was not really many urgent cares, and the ones that were mostly doctor's offices with very narrow hours, and they really don't fulfill the true calling of an urgent care. We believe that the difference between an ER and an urgent care was limb-saving, life-saving goes to the ER. Anything else could probably be seen at an urgent care. And when we did the RFP, many people went and said, we're gonna make a proposal. In the past, we had proposals for individuals in the community that wanted $1.7 million to do urgent care in their clinic, which is not an urgent care. They didn't have the experience with urgent care centers, nor had they operated one, nor had any real experience in the last 3 years. Only had one provider that applied, that met that criteria. After discussion and entertaining the many possibilities, they went ahead, and that was the Dr. Tyson Medical Group.
Now, were there any things, like, any special requirements in the selection of the entity or the provider that you chose?
Definitely.
Besides everything that you mentioned, I mean, non-profit status, profit status, any of those kind of things?
We went through the whole round, and one of the, we believed there was going to be more proposals for RFP. We were hoping that El Centro would apply, UCSD would apply, Pioneers would apply. And I haven't been an ER nurse before. I kind of know both of the ER groups and like the ER groups because they're very strong when they manage an urgent care. Because you have that connection to the emergency room, right? And somebody could see a patient in the urgent care, and because they know the guy's working in the ER, there's a lot better communication and transfer of data, et cetera. But neither applied for the proposal. So we did look at some point and had a legal opinion to make sure that we can partner with somebody that was a not-for-profit. But eventually, the Dr. Tyson Medical Group did form a foundation.
So then when they were awarded it, you're saying it was legal? Because they didn't have to be a nonprofit at the time?
And their landlord, and we're the landlord, they pay a lease. Right, so we're just gonna do it. Yeah.
So they didn't have to be, like when they applied, well, they're starting whoever.
Yeah.
So when they applied, did they have to already be a nonprofit prior to applying for it? Or was there something in writing where, as long as you get approved as a nonprofit by a certain period of time, then you're gonna be okay?
We went out for a legal opinion on that because we didn't know initially when we started drafting this, and we went for a legal opinion, and we found out that we can do it now. When we first started talking to this group, they were not a foundation. They became a foundation before the construction started, I believe, if I recall correctly. We're talking almost 3 years ago.
Who's the, I'm sorry, who's the members of the foundation?
Good question. I don't know. I just know Dr. Tyson's significant other is a part of the foundation. I don't know who the rest are. And like I said, we did get a legal opinion to make sure that we can, number one, provide a grant to them, and also that we can rent to them as well. So the lease does hold 5 months free, no rent for the first 5 months, and then it picks up and has multiple costs in it for extension or not extension.
And the only way that you recoup the money is by the payment of the lease?
Yes.
You have no management say or anything in the urgent care?
No, we just talked about reports and quality metrics, but nothing on the actual agreement, not yet.
So what is it supposed to occupy this building and provide services?
Well, so one of the challenges in the last several months, there was issues with the IV. Another issue was getting the right concentration of lead lining and the walls that go in the CT room, because this is going to be a full urgent care with imaging, lab, CT scan, etc. So the latest as of November 1, Mitchell Builders is being fined $500 per day because they didn't meet the deadline to have the building done. So right now the building is about 7,700 square feet. The north side of the building, which is about half of the 7,700 square feet, is probably going to be ready in 60 days. The south side where the CT room is going to take a little longer because of the lead lining. Engineers just got that approved about a week ago, and they're starting, the power came in, transformers in, and they're moving forward. So they're telling us 2 months to allow the group to move in and get an occupancy permit.
How much have you gone over budget?
Well, the budget, as far as over budget, I don't believe we've gone over budget yet. The initial project with IBC was about $2.5 million. We are now at about 4.5, 4.7, because the building originally was going to be big shells, 2 big shells or 3 big shells, and one of the areas was going to be used for the board meetings on the off hours, and it was going to be classrooms the rest of the time. Now we went in and had the change order, and there's multiple exam rooms, observation suite, treatment rooms, and the CT room, imaging room, and the laboratory. So it's pretty big. It'll be the biggest urgent care center in the valley.
So what is the current liability that's outstanding from Heffernan for this building?
I think we're about 85% paid already. So at the end of the day, when that building is paid out, we're holding payment right now until they finish the building. And the last numbers that I got from Rosario was, I think that we need, we're about 90% paid already.
Is the lease a one-year lease with Dr. Tyson or the provider?
Yes, and it has an out clause.
A what?
An out clause?
How much is the lease?
Oh, geez, it's a dollar something a square foot, and for the first 5 months they get a buy on it, and then they start paying rent. So it'll be somewhere in the tune of, I believe, about $10,000 a month initially.
So, he's going rent free for how many months?
5.
Why did you guys agree to that? Or the board agreed to that? Why?
He asked for
Is he like the only person that could have provided this? And there's other, we have a lot of doctors here, a lot of providers. I'm sure we have expertise of people that could have fulfilled that role and not have to, because to me, why are you gonna give something for free if they're the ones that are coming in and profiting, right?
Good question. So number one, Calexico has a huge underinsured population. Number two, we did the RFP and nobody else was interested in operating it because they didn't apply. So you begin to put these to a fund, and at the end of the day, it says we're interested. We even had a town hall meeting, invited a lot of the providers, all the local businesses. A lot of people said they're going to apply, and none of them applied about when. And the board went back because they were concerned about, is that enough? Is that enough? Fortunately, the guy that applied had met all the check boxes that he qualified to do the urgent care.
Okay, so now that we're gonna become a district and we're in his own cabinet,
Yeah,
he hasn't occupied the building, right?
correct.
So where would we be if we decided to let him know, hey, you know what, we're gonna put this out again? I don't know if that's something we can do.
Depends on the contract. You could have a potential breach of contract action.
Although he hasn't occupied it.
Correct. Last night, they came to a Heffernan Memorial Healthcare meeting, and they believe they would like to occupy by August 1, July 1, August 1, if it's ready. Now, we do know that the north side's going to be ready, which is the exam room area. The south side is going to be more of a exam room, outpatient lab and imaging.
And was this the grant that you gave 2 years ago to,
Yes,
and how much was that grant?
it's about $450,000.
And what did they do
Well,
for
that-
that 450,000?
Good question. So the evidence that's I'm open to, and that was part of your question as well that we didn't answer, was that why did they give a grant? Because number one, they had to train providers, train staff, buy initial equipment. We don't own, when we did not purchase the equipment inside the building. And so the board at the time, we had a grant available when they were focusing on urgent care because that was the biggest thing in Calexico. We were having a lot of issues with, at the time, COVID was still very active. There was a huge demand for healthcare. And in hindsight, things are a lot different than when you're before them. So one of the biggest challenges was that we needed an urgent care in Calexico more than anything. But broadly, Central both have clinics in Calexico. But they're not urgent care centers, guys. And on a good day, you get in and out in about 3 hours. Heffernan, before my time and even during my time, went ahead and did work with the local hospitals to extend their clinic hours to later hours in the day and even have an urgent care. But all I really turned to was a transport station. You get there, you have a broken arm, you have to go to the emergency room. You need stitches, we're going to send you to the emergency room. And that's what it was. And I think that somewhere along the line, we missed what we were trying to do, which was take care of the patients in the right setting and not transport them to Bolivia or Center or San Diego. So it was really trying to mitigate a lot of the concerns that the Calexico community has. One of the things we discussed with Dr. Tyson Medical Group was you have to take all comers. And obviously, because this is Calexico money, it was for Calexico residents. Now, we know that in urgent care, anybody can show up. But an emergency room is like it's not an urgent care, it's not like an emergency room where you have to take all comers. Which means that emergency rooms fall under Impala, urgent care center still. And we also asked Dr. Tyson to work with county EMS to find out if EMS, with the county, to find any EMS to pick up patients at home and bring them to the urgent care. Because currently, patient falls at home and they have a fracture or they need to go to the hospital, the ambulance picks them up, they have to go to the hospital. We know that there's settings in the United States where that could be addressed if EMS works with the community. We're hoping that in time, either there's various partnerships with the emergency room, or eventually somebody like the emergency room or the local groups want to work together with the hospital, because if it's a hospital type urgent care, it may fall under different rules under the government. So the money that was given was very specific, so that they can get all their staff trained, etc. We wanted to make sure that a doctor was going to be available, not just NPs, that the doctor was bilingual, because if some of you are not bilingual, a lot of the information that when you get an interpreter is missed. That's why the government insists on using a special line and get the right interpreter for the program. So after a lot of discussions with the board, because this was discussed in several meetings, the board opined that this was the best group to go, because still to this day, it was our opinion that they were the only true urgent care in the county. And they were the ones with the experience, and they were the ones that met that criteria, that they wanted to make sure that Calexico residents have an urgent care where it's easy to access. I don't know if you know this, but if you ever get a chance to drive through Calexico, you're going to see shopping carts everywhere from the grocery stores, because people, the seniors, walk to the store, and they walk back with their groceries to their apartments. So we wanted to make sure that there's an urgent care nearby where people could walk to. We also wanted to make sure that the urgent care had a pharmacy. And one of the things the district was working on was that for those folks that don't have the money to pay their co-pays or to get their meds, that somehow the district will help cover that for those residents of Calexico. You might say, why? There's studies that have been done by Yale and different universities about people that get medications prescribed, only 50% of them take it. Is it a matter of copay? It may be. Is it a matter of just, I'm not taking it because I don't believe it? I believe Dr. Google. At the end of the day, we wanted to facilitate that these patients had it nearby, it was accessible, it was open during the night hours, which means that they're really early. And can people go before they go to school? Or are they open so that when I get home with my car, I can take my family to the urgent care? So a lot of those conversations have place with the group to make sure that they would satisfy the needs. And at the time, the board decided that it was the best decision to give the grant and ensure that all those things were going to be handled and offered to the Calexico residents. Just so you know, Calexico residents, for those of you who don't know, there was a study that was done by Calexico Fire Department, because they were trying to expand their their billing issues. When I first came to Heffernan, and they asked me to come and take a look at their numbers, see if we could help. And 50% of ambulances that go to both hospitals come out of Calexico. 50% of ambulances, right? What does that tell you? That we have a huge issue in Calexico. So we were hoping that, we knew that we're not going to get a hospital there. Some politicians were running on the premise that they were going to put in a hospital in Calexico. They had one already. It doesn't work that way. So we knew that the next best thing was to have an urgent care. And that's like I said, it took a lot longer than we wanted to. We did not let the construction company off easy. They had to show us why all these delays were. They would be fined per day right now for those delays. A lot of them seem very legitimate. Now, I'm not a builder, but on that board, we had an engineer before. Mr. Lopez himself had a contractor's license, and believe me, they were there going over every little detail. We do walkthroughs all the time on the building. You're more than welcome to come look at the urgent care. It's going to be your urgent care in a matter of months. And the building's coming along. We recently went over and did a walkthrough and had them take the whole floor out, because there was an issue with the flooring that Mr. Lopez and Dr. Tyson and myself didn't right. And they have to go back and take it off when they're done. So it's going to be a nice urgent care, and I just want to make sure that it's stated that a lot of people have told us they believe that we're paying money under the table, that we're stealing the money. You should try doing construction now versus 10 years ago. It's very costly. And when we were told that if we were to move with that urgent care, I mean, we're talking about $600 per square foot right now, and you know that's very significant. And when they told us the difference between construction brand new, knocking it down, and making it brand new again versus what we have now, it would be even more expensive. So that's, if you have any questions on that building, it's urgent care is a passion of mine. I'm sorry if I go on too much, but if you were to walk in the community, and I'm fortunate, I used to work home health in Calexico, so I could tell you that a lot of the people there, guys, don't have a car to go to the emergency room when they want. Is it abuse of the ambulances? I don't know. But I do know this, that if I could treat a lot of your problems before they become an emergency, it saves the system a whole lot of dollars. And one of the reasons we have so much cancer stage 3 and 4 is because we don't detect it on time, because we have a big old line to get seen by doctors, even now. So the best thing to do was, we found a solution for the problem, and that's why the urgent care, it was getting done. And I guess all criticism, if those people criticizing would actually know healthcare and would know the community, they would realize that it's the best thing that could happen for Mexico, short of a standalone ER, which we're not gonna get because the law does not allow for that, right? So, that's my soapbox. Sorry.
So with the amount of ambulance services, like you mentioned earlier, I mean, I'm sure that took a toll on the fire department, right? So
Yes.
did you guys as a district provide any funds to help them out or anything like that?
Good question, to our detriment. So, and what I mean is, I believe that at the time, the board had the best intentions in mind. The fire department and the city were short of funds to fund the department. The department came and did a great dog and pony show. Heffernan wanted to help. Heffernan has paid for defibrillators for police cars, for the fire department, paid for ambulances for the fire department. I don't know how many, but I know that it's been a few $1 million.
Everyone paid 1 year the fire department because they didn't have money to run the ambulance. And that was like $1.2 million that we gave to the fire department so they would be able to continue to do the ambulance. Out of everything that we have given to the city of Calexico, where we had given the most money is on the ambulance services, because that was our hospital on wheels.
That answers my question.
Okay. And just to add on a little bit to that, to add to the answer was that like, I could have said it better. That was the hospital at Heffernan. Yeah, I know, so you can see because of the reviews. The Calexico's fire department is city-owned. It's very different to the county one. And there are their own politics. And at one point, I was told by LAFCO when I came on board that if we wanted to donate any more money to the city, we would have to have a conversation with LAFCO because it was really not the district's position to be doing that. And that's why you see a lot of the politics and maybe negative politics about what's going on, because we could not fund it because we had an agreement with LAFCO because Heffernan himself was dissolved. And when we came on, we asked LAFCO for 4 wishes or 3 wishes, and one of them was exactly that, and that's why during the last few years, we did not donate any more money for the ambulance service or some of the city programs.
Are there any more questions?
Do you have the finances for IVHD?
Yes. So current status, where we're at about $2.7 million on the bank. We own the office that we're at, 601 Heber Avenue. It's a small office, less than 2,000 square feet. That place needs to be redone, period. And the urgent care in a position for $500,000, that's now close to $800,000 or $900,000 with the interest that was owed for that investment. As far as the no, it'll be here, on the financials. Okay. Sorry. I had it over there. Okay. Expenses so far, $25,000. We have not included this year, this month, with legal fees. Legal fees are, there's some that are coming up, we discussed those, but this is for staff. And the smallest bills obviously are for getting the internet, et cetera, but these are for the operations, for the staff that are working with the administrative side. These are being contested by our district, so we're gonna go back, and this may go away. But I believe, I am pushing for at least my staff to get paid for that, because they are putting a lot of time in addressing some of these issues. And under the law, we were given, you could spend money on finances on making sure the administrative and clerical components are getting addressed in the district. And at some point, our district did have a conversation about it, and we had an agreement, but as of last night, that people forget, and I guess it's the heat coming back, but we'll go back, and if the funds need to be returned to the district, they will. And hopefully we'll come back to you with an answer that's solid for the next meeting that we give you a report. But I do know that a lot of invoices came in last night for legal, but we already knew that. And hopefully by the next meeting, you can have a very black and white report as to this is what we spent. And the good thing that came out of it was something that you're going to discuss in the next item of the agenda, that Heffernan yesterday did make a motion to help IVHD, to make a special account for IVHD, and for multiple parties to put some money into that, but I'll wait until that item is discussed, which is the next item.
So what are the holdups with Heffernan?
Right now, it's just internal politics. We have two sides, a divided board, and our senior board members heard everything and remember, but some of our more politically driven members forgot what they said a couple meetings ago. So we're gonna take that back and address it.
Because the law outlines that Heffernan is to pay all the legal fees and admin costs.
Yes, thank you. Yeah, and pretty much what they would ask is they want some kind of document that says, look, these are the allowable costs and here's the rate, et cetera, which we could do on our budget once we get a budget set up in our account, and then you decide what goes, and then it comes from your account.
Are these documents on the website?
They will be, as long as we put our audit report on there, but on the Heffernan website or our website, because we can put it on our website.
I think on our, because they're not in the packet, so.
Oh, okay, sorry, we did, was it the email? Okay, not the audit.
Yeah, that would actually like a copy of.
We'll load them up. Mr. Agreement does that, we'll make sure that he uploads the documents.
So this is just up to 4.2 then, right?
Yes.
So what's the reimbursement for the mileage?
Oh, that's for, our district allows for mileage for board meetings or special events, like if Mr. Valdez was to go to
Why is it being charged to IVHD?
They shouldn't be. That's something that's going to be corrected. This is the clerk. The clerk did a report at the last minute, but it's not. But like I said, we need to go back and make sure the report's appropriate. There was also a meal charge to IVHD, which doesn't belong there. So we have to have a conversation. We're meeting with the gentleman that does the audit, so he could teach her how to put in the right settings and not that sub account. Yeah. And I think that's it. And the second Wednesday of next month, to talk about and possibly sign the agreement. That's an updated agreement of where they're at, and they're gonna use the report about those parties interested in buying that plot of land, which would definitely bring back the money we have for it.
Well, okay, so just my opinion, I mean, are you guys committed to anything with these investments? Are you really like committed? Because,
No.
so are you guys taking it as a loss or as an asset?
The position is, we want our money with interest, and they've agreed to that, and we're working with our legal and with their legal to put that in a document where it's something tangible. There's been a lot of conversation about it, because there was a conversation, this is what the public knew. There's a party out there in Calexico that keeps saying that somebody took the $50,000 because the promissory note was for $450,000. There was another promissory note for $500,000 with an attorney that used to work for us and recently worked for Pioneers. And the issue was that somewhere along the line, they lost the true contract and the group in San Diego didn't have it. Heffernan has had the conversation with Mega Park, and they've agreed that it's $500,000. And they're gonna put that in a document and talk about, at least clarify it in an updated document that says, we did receive your $500,000 investment. It's getting 6% interest year over year, and we will pay that as soon as we get our money. But at some point, they offered another piece of land for it. We said no. Heffernan wanted the money. And that's where we're at as of yesterday. I had a conversation with them.
How long has this been? How many years?
Jesus, we're talking since 2008 or 9. So we're talking about, almost 15 years of 6%. I mean, it's not the best investment strategy, because I don't think that was the intent originally. Heffernan actually thought they were going to be making a building at the time of the budget.
So, I'm not satisfied with that small explanation, and I'm sure there's more details, right?
Oh, yes.
Can we agendize having a presentation of everything from start to finish on that issue itself?
Yes, definitely.
Because that's just a lot of questions, just listening to what you're saying, that's a lot of questions. And you just came into the district, 2-3 years ago?
Yes. So if you would like, I could even invite the Mega Park leads
I think
and their attorney.
that's something that'll probably get resolved during the due diligence process as we dissolve them and require them.
Well, I know that, I just want to know more information so that we don't have any surprises. Because I wouldn't want to be on the hook for certain things that you may not even know about, right? So the more information from you, the better. That's the only reason. Because, yeah.
And right now what we're doing is we're trying to get up-to-date documents that are very clear and concise to the point to show that their investment is secure. So yesterday they reiterated that, and they are going to be on the agenda for the next meeting. Another thing we would love is if any of you want to come and ask that same question at the meeting, which will be the second Wednesday of next month. But we're definitely going to have usually those meetings last about 2 hours just talking to them. So, like the president said, the board chair said, that's something that's going to come out, but definitely more than happy to get that information. We're not happy with it, we can't redo this, it's already done. So right now what I'm trying to make sure is that we have all the documents in order so we could get our investment back with the interest that was promised and signed.
Any other questions?
May I come up to speak?
Yes.
Good evening. Sylvia Brunel from the Heffernan Board. I'm the president. On the mega park issue, I know about that, and I know that that money is secure. I think that there's some misunderstanding. Right now, Heffernan is the one that's sponsoring all the expenses that are being incurred by you. And this Heffernan deal with the mega park, that's ours right now. It's not yours. Do you understand what I'm saying? And we're having a meeting, as Mr. Rita has said, where mega park is coming. It's going to be in closed session, but we will come out and give a decision. The $500,000 are there, and it's there with interest, and it's already gone close to $1 million. So it's like if we have money in the bank. There is no issues about that. I don't want to find out later on that this is not, that something's wrong. There's nothing wrong. You know, when we get ready to turn over in January, you're getting, I think, you're getting a lot from us, because we're the only ones right now that are financing you. And I don't appreciate that you're questioning us from Heffernan, that what we're doing with our financials are not correct. Because we're here to help you. We're going to be gone. And in no way would we want to leave you with a burden. And I hope that's clear to all of these board members here, that we're here to work with you. Why are you coming back and you want to know about us? What are we doing? What are we not doing? My God, we've been, how should I say this? By the grand jury, we've been investigated. Because there's always people out there that think they're doing something wrong. We've been on LAFCO for 5 years on probation, where every quarterly we have to report. LAFCO we just got off probation. They didn't find anything wrong. They didn't find anything wrong when we were with the grand jury. There's nothing that's been found that we are not doing the way it should be done. Please, we need your support. We don't need for you to be banging us down. We're not doing anything that we shouldn't be doing. I just want for you to keep something in mind. Assemblyman Garcia appointed the Heffernan District for a reason. We don't have anything to hide. And we were the ones are the neutral. We're not pioneers, we're not out central. We're right in the middle. And Heffernan wants what's best for the community. Not what's best for me, not what's best for you, but what's best for this whole community. I just want to tell you that if you want to know about our budget, it was just posted last night. If you really want to look at it right away, you can go into our webpage, and it's there while you get it from Mr. Pimentel. But please, have a little faith in us. We're getting static because why are we funding you? That's hard for me to be hearing from people that don't understand that we want to have health care for everybody, especially Calexico. Because the situation with Calexico is worse than any in the county. So please, don't be here questioning us. We're funding you, everything that you're doing, and even that's getting questioned.
I'm so sorry, that's your time, your 3 minutes have expired.
Thank you so much.
Thank you.
Thank you.
Can I make a quick comment? To Bernard's point. You know, the way I took this an opportunity to explain something that needed to be clear in the air, and I think that there was not an ill-intentioned question. It was something that I've heard from the public even before I went to Heffernan. And it's not an attack, it's a good opportunity to clear the air. And I'm sorry for delaying this meeting, but I do appreciate the question, because you're right. And I think that there's nothing better than a clean handout when this happens, and you're just trying to get to the bottom of it. So I'm more than welcome to spend time with any of you to clarify that. Please let us know. And as your wife, Bernard loves IMPERIAL, and she's been great since she's been on it. And I think we see things a little different, but this is why I do recognize the opportunity to explain it and clear the air. And we definitely, there's a lot of things that we need to clarify, and we definitely want this to be a clean handout. So thank you for your question. Thank you for asking that.
I want to personally apologize to you if you took it personal, because that wasn't my intent. Just like Tomas said, that's all. And I asked, I believe that the tone of my question was no different than when we had the CEO and the CFOs from both PMH and El Centro Regional. So, but if you took it personal, I apologize.
No, I didn't take it.
I would just like to make the statement that I'm glad that the two of you are very passionate, because that's reassuring to me. Me also coming from a very small community that is completely underserved, like the rest of the valley. You know, if you had taken less of offense to that, I would have some questions about that, because it does show that both of you are equally passionate about the Heffernan district, and that gives me more assurance when we move forward with this. So I just wanted to point that out. So thank you for your comments.
Any other comments, questions? So let's move on to item F, discussion and possible action regarding creation of bank accounts and requests for additional funding from Heffernan and Pioneers in Warren Healthcare District.
All right?
Yeah, sure. So I have here the language of AB 918, and you've heard some of this discussion in what just arose in review of the Heffernan and IVHD financial statements. So one of the concerns that I've heard from Heffernan that I believe the Heffernan board has is that AB 918 provides some specific language for funding for administrative employees, financial means to hire administrative employees, financial resources to complete clerical tasks for board meetings and public meetings, including creating agendas, setting up meeting locations, dates, times, and ensuring the transfer of existing healthcare services with minimal interruptions, providing the venues and the financial means for a venue. It's great that we're able to meet here for free. Providing the financial means to hire legal counsel. So I've heard concerns about, for example, other expenses that we're going to have to incur as we continue to move forward in this board's goals and purposes. And we're going to need money to hire more folks, such as at some point potentially we'll have to hire, well, for example, one of the items that I was going to bring to this board meeting is a business expense and reimbursement policy and a board compensation policy, which would provide, consistent with the bylaws, consistent with the health and safety code, and consistent with the practices of every healthcare district in the state of California, a very modest compensation for the board of directors, which is about $100, which you can increase by no more than 5% every year for attendance at the board meetings, and you would be compensated for example, mileage, because gas is very expensive and many of you are traveling from very far away to get here. But there's no clear funding mechanism for that in AB 918. It doesn't mean you're not entitled to these expense reimbursements, and it doesn't mean that there's not money out there that can be used for these types of expenses. Heffernan, Pioneers, City of El Centro, or ECRMC can agree to fund expenses such as those. And we thought about an easy way to do that would be to have this board consider whether it would like to direct us to put a written request forth to PMH and Heffernan, or PMH and Heffernan and El Centro, for equal funding for a bank, a separate bank account, which would be within the subset of the Heffernan bank account. So imagine your bank account, and then you have the savings and a checking, and you have another checking, which would be specifically for IVHD. It would be populated for IVHD so that you can segregate your funds from Heffernan very clearly, and you can have funds at the board's discretion to utilize moving forward if you need additional consultants or additional folks. Or expenditures for websites or stuff that might not be expressly provided for in AB 918, but that are normal expenses of a public healthcare district. So, because we've heard this kind of tension or apprehension from Heffernan, we said, okay, what if we ask for what if we make an official or a formal written request for additional funding from Heffernan and Pioneers, and ask them for funding, for example, for $150,000 from each agency to put into a bank account that would be IVHD's bank account, since you're a separate legal entity too, for the purposes of running your organization. And, you know, that would be open and transparent. The public could see the check registry just like all the other healthcare districts. But there would be some clarity about money that you have in the bank that you are authorized to expend in the manner that you think is appropriate, without the Heffernan board feeling like, why am I authorizing this expense if it's not expressly provided for in AB 918? They would have to make their own findings that, you know, these are appropriate expenses for the district, for the Heffernan district, or for the Pioneers district, in light of the fact that you are their successor agency. So my recommendation is to create a separate bank account or a subset bank account from Heffernan's bank account, and request additional funding for Heffernan and Pioneers, so that you have some modest amount of funds at your discretion, and you don't have to be, you know, stopping and waiting for approvals month to month, because of course neither board can meet except for in a public meeting, which typically happen once a month, and that can be a huge delay, and we don't have time for delays right now because we got a lot of business to do. So that was a thought that we had, and if this is approved, we would send out a written request that both boards could in good conscience consider and approve. And then they don't feel like, okay, well now I'm spending money in this weird way. They're sending money over to the bank account, and then you are deciding how to spend that money. So we just thought that was a potential solution.
Yeah. And to add on to that, you all recall the conversations with all stakeholders at the airport with Assemblyman Garcia, one even with the Secretary of Health and Human Services, that when they explicitly discussed the $28 million that each hospital got for distressed hospitals, they did state their intention, and they, I mean, Assemblyman Garcia and the Secretary of State, the Secretary for the Health and Human Services, that they expected some of those funds to be utilized for the district and the dissolution of the districts and us creating this new district. Furthermore, I would say that maybe perhaps I'm just recommending that we include El Centro in this, and what a show of good faith, right? I mean, PMH always kept saying El Centro doesn't want to do this, doesn't want to do this. Why don't we let El Centro decide if they want to do it, but also have it thrown to the pie equal amounts? Because guys, this is going to be expensive, but we know that it's worth the price. We are going to have a better district, and we definitely want to build something way better than before. So, not that it's bad, but I just want to make sure that if we're all going to be together, why wait and start working now? Since if you all remember the discussion that we had, for those of you that weren't there, we were told numerous times that they were hoping that we use part of this $20 million to help this new district become what it needs to be. That was as much as
And I just have a comment that last night at the board meeting for Heffernan, we set up $150,000 to be set up on a different account, a different line item on our budget for IVHD, with the condition that the other two stakeholders, CRNC and PMH, will contribute the same.
And just to clarify, because some people are saying, oh, it's $150,000 only. No, that's just the initial.
Mm-hmm.
We know this is going to be more. So an option is to request even more from each one, but maybe have.
Quarterly.
But,
Yeah.
exactly. So I would prefer to do that.
to make the motion that we create that separate bank account and request from each of the stakeholders, as was discussed before, to include El Centro, and make that request of each of them and come to terms with what that'll look like as far as contributions, whether that be quarterly, monthly, weekly. And so I would make that motion to move forward with that.
Second.
I have a motion by Mayor, second by Valdez. All in favor, say aye.
Aye.
Any opposed? Any abstentions? Motion carries. And we'll move on to item G, updates regarding AB 918 obligations and negotiations.
Yes, thank you, Madam Chair. I'll take that and I'll try to be brief. So we had a kickoff call with Special Counsel Hooper Lundy last Wednesday, and I've received a new timeline for pre-transactions, and I received a timeline for regulatory actions, which I want to just very roughly inform these board members you what these timelines sort of look like with respect to the hospital acquisitions. So there are a few hospital licenses. One is we'd have to submit a CHOW application to CDPH, that's for the hospital license, up to 100 days prior to close. The hospital license would then be issued to IVHD. There's a pharmacy CHOW application and a temporary permit application, which would have to be submitted 60 to 90 days prior to close to get temporary pharma permits issued, and permanent pharmacy permits would be issued up to 6 months post-close. We have to submit DEA registration applications to the DEA and execute a DEA power of attorney. We have to submit Medicare 855A applications up to 90 days prior to close, and then we would get recommendation letters and other kind of enrollment records post-close. There are, a lot of acronyms that I candidly don't understand, but we would have to figure out here. There's a lot of stuff that would happen in the last 90 days prior to closing with OCHA. And so these timelines are kind of big picture timelines that I've gotten that, once again, what we already knew is it suggests that the timelines prescribed by AB 918 are very ambitious. So we've got to get started right now. And these timelines for regulatory submittals are going to be incorporated in the timeline that we've put on our website. They're going to be plugged in so that we only have one timeline. We don't have 5 different timelines we're working with. And so that roadmap, as we've discussed before, can continue to be a living document, and we can have full transparency about when our drop dead dates are for submission of hospital licenses, etc. So that we've got what's called a data room set up. It's called HiQ, that's the name of the site for the data room, so that we can start, and we've already started updating licenses or updating documents to the document database, so that we can start putting forth our diligent or the items we're going to need for our diligence requests to PMH and ECRMC. I have asked PMH and sent over kind of a while back the request for PMH's approval of the NDA. City of El Centro and ECRMC have agreed to sign the NDA that we approved at our last special board meeting. PMH has informed me through their counsel that, I'm just trying to remember the deadline, they have a meeting scheduled for April 23rd where they would consider the NDA. So it's a bit out, but we'll see what they say with respect to the NDA. And if so, then we're hoping that PMH will send over their data so that we could get that Kaufman Hall study updated. We did get, as you know, Preston Hollow to agree to give IVHD ownership of the Kaufman Hall study. So we've got that, and we've got the full study in our possession. We had very productive preliminary conversations with both the City of El Centro and ECRMC. about potential strategies for acquisition, including a meeting today with the board chair and folks from UCSD and ECRMC. And we expect a letter of intent to be submitted to us for consideration, which will go first to the negotiating committee for the negotiating committee to listen to, consider, figure out if we need more, if we need something different, if it's good enough, if it's not good enough, and if we've got something to consider from ECRMC and El Centro and UCSD, or I don't know if UCSD would be involved in that, but whatever the LOI, terms are, if the negotiation committee will bring them back to this board with a recommendation so that the board can make a policy decision on which way to go, which way it wants to go. Or whether or not the terms are something they want to entertain, or whether or not they want to respond to the terms or propose different terms. So that's been very productive, and we expect that LOI maybe tomorrow, if not in the next couple days. Everything I feel is moving in the right direction, and I'm happy to answer any questions from the board about the status of negotiations. Basically, we haven't gotten much from PMH, and we've gotten a lot of information from El Centro and ECRMC.
My thoughts are that, my thoughts are that El Centro Regional has always been wanting to meet with us, and their position is always positive in that regard. That's my own assessment, and so I appreciate that they are willing to provide whatever information we need so that we can move forward, because our timelines are very aggressive, but they're achievable, and the more positive interaction we have with these entities, it's going to make it that much easier. So that's just my own assessment.
I forgot, we also have an appraiser for the El Centro properties, which is VMG, which has submitted a proposal, and as far as I'm informed, that's the direction the city is going to go in to get an appraisal for, and that is really going to set forth all the properties that are involved in the potential acquisition and the value of everything involved. So that's another update which is conducted. Got for this item.
Do you have any questions from the board? We move on to item 9, presentation by a National Demographics Corporation.
Oh yes, I'm sorry. I'm so sorry. That's my bad. Hello. This is Jeff Tilton, and he is a senior consultant for our demographer NBC Research. He has traveled here to this board meeting to give the first of 5 or 4 presentations that we're going to have. So the healthcare district law requires, and he'll go into this in some more detail, 2 public hearings on districting before maps can even be drawn. So this is the first of those 2 hearings. And on the items for future agenda, I'm going to be recommending a special meeting, hopefully in the next 2 weeks or 2 weeks from today, so that we can have the second public meeting to discuss districting and we can get to work on the maps. But this is Dr. Jeff Tilton, and I'll turn it over to him. Thank you. Sorry.
You're okay. We rehearsed it.
I know. Sorry.
We didn't rehearse it. I'm sticking around. So as she said, this is the first of 5 public hearings. And over 4 days. And so typically we would take a jurisdiction that would be voting its governance board via at-large, and that are converting to a by-district elections to support the California Voting Rights Act, which was specifically written to encourage by-district elections. So it's a unique situation you're in, but everything you're doing is a unique situation. So with respect to the California Voting Rights Act, under the Federal Voting Rights Act, a jurisdiction must fail 4 tests before it's in violation of the law. But California strikes 2 of those 4 tests, which makes it easier for a plaintiff to go after a jurisdiction saying they're in violation of the California Voting Rights Act. So, and I bring this up because if you decide you did not want to go by district elections, it's costly. All those jurisdictions that tried to fight going to by district elections have lost a lot of money. And that doesn't count you were talking about insurance money earlier. That doesn't count the money that was expended from human resources, et cetera, legal counsel, and stuff like that. So a number of jurisdictions have moved to by district elections over time. So with that, we have 2 initial hearings that you won't even see maps. It's to educate the public. It's to get input from the public as to what should the districts look like in this jurisdiction. By May 2nd, if not before, I'll have draft maps available to post to the website because we have to meet a 7-day requirement by law to make sure that those maps are posted by the May 9th public hearing. So you won't even see maps until May 2nd. And then on June 13th, we will have 2 public hearings, and hopefully you'll pass a resolution by the end of June 13th, and there'll be 7 districts. But we must follow some rules and laws here. So we must follow the federal laws, which we're going to try to create 7 districts of equal population. Really difficult to do because we use census blocks to do this. And I like to say census blocks are like snowflakes. There's really no 2 alike. They're in different shapes, sizes. And inside those census blocks are different population numbers. We're going to follow, but however, the courts have allowed us to have a 10% deviation among the 7 districts. We're not going to talk a whole lot math tonight, but we'll get to it on the 3rd public hearing. We must follow the Federal Voting Rights Act and have no racial gerrymandering. Then we shift into California, which is unique for special districts because the law was updated that now impacts special districts and school districts, where it only applied to cities and counties. So in prioritized order, our 7 districts must be geographically contiguous. We want to minimize the division of neighborhoods and communities of interest throughout the districts. And we want to minimize divisions of cities and census-designated places within the jurisdiction. We'd love to have easily identifiable boundaries, and we want our districts to be compact. And something moving forward, because we're going to do this again in 2031 as part of redistricting, we shall not adopt election district boundaries for the purpose of favoring or discriminating against an incumbent political candidate or a political party. And then we have some language about AB 918 in there as well. So in order to draw these districts, we are using the 2020 census data. So you can see up there in the jurisdiction that we have here, there were 173,626. So you see it at the very top, right in the middle. That's the total population within the jurisdiction boundaries from the 2020 census. And then we're going to look at, with respect to increasing the voter strength of the protected class, we go down to where it says citizen voting age population. So that is all citizens who are 18 or older. They may not be registered to vote, but they're eligible to vote. And we use those data to look at the voting strength of the protected class. In this particular case, it would be the Hispanic or Latino protected class. So in each of the 7 districts that we're going to try to create, we want to try to get 24,804 in each district. And you'll get a table, etc., that looks similar to this with all 7 districts. That'll show you all sorts of data in those particular districts on every draft plan that comes before you next month. So they're also looking at the concentration of the Latino citizen voting age population. And you see all those colors represent a percentage or a concentration of where the Latino citizen voting age population reside within the jurisdiction boundaries. Now, sometimes that could be misleading. You know that perhaps in the east of Holtville, you know, there are a lot of residents living in that spot, you know, so the numbers can be skewed with respect to, I mean, that's one census block, to give you an example. That's in the southeast corner there. So that just gives you a visual of where the concentrations are with respect to Latino citizen born age population. So in this process, we're asking the public, the board, how do you describe or name an area where you live? What are some of the geographic boundaries, the neighborhoods? Are there certain parks, roads, canals, school attendance zones, etc.? We use all these data to help inform me in drafting draft plans for you. Community of interest, we now have a legal definition. It is a population that shares common social or economic interests that should be included within a single district for the purposes of its effective and fair representation. So now, with respect to any comments you might have, what you consider a neighborhood, communities of interest? I know this is brand new, you may not be ready, but I'm a former educator. You do have a homework assignment. So next time I'm here, I hope to get some input from you. But happy to hear any questions you might have before I turn it back over to the chair.
Any questions, comments from the board? Any questions from the public?
I have a quick question. Are we going to get this slide?
Yes, I think we did.
Did
Yes.
Once it's also uploaded on the website.
Okay.
Oh, okay, yeah, because we haven't received it.
What screenshots? My homework son.
John Grass, just a point of order. In regards to this, I didn't realize this was one of 5 public hearings. In my experience with public hearings, if they're, have a section of their own within the agenda, and they're noticed along with the notice requirements. This is because if you're having a public hearing, you want to invite the public to be a part of the hearing. Without that notice, people don't know you're having a public hearing. And so I think it's important to invite the public to be a part of this process, to have an interactive process. If you're not going to invite the public, there's not much point in calling it a public hearing. So I just encourage you to note it on the agenda item that you're holding a public hearing, which is an invitation to the public to take a more of an active interest. Thank you.
Thank you.
Any other comments? All right. Any items for future agenda?
I do. I have, just piggybacking off of the presentation that we just had, because we want to comply, so the requirements of AB 918 are different than the requirements in the healthcare district law. What we're striving for is compliance with both. So the healthcare district law is the law that requires 5 hearings prior to approval of the resolution. And because we have this deadline, I would like to bring back the final maps for approval at the June board meeting, if not sooner, which means we'd have to have maps presented in May, which means we need another public hearing on introduction to districting between now and our May board meeting. So what I'm asking for is a date, so that we can set that date right now, and it would be solely for the purposes of a public hearing, to discuss the proposed districting process again. So I don't know whether the board could look right now at its calendars and see whether April 25th would be available for another public hearing. I think that's, Jeff, that's the date we decided, right, or we had proposed. So that we can have our second public hearing, and I am happy to notice it more prominently as a public hearing in the agenda.
That works for me.
April 25th, so it's a Thursday, 2 Thursdays from today. And presumably it'd be at 6 p.m., or it could be at another time if you'd like.
I'm good on that.
How about, if we did it at 4, would that change, or? Okay, well, we just need a majority of the board. Okay, so we'll plan on having a special board meeting the evening of April 25th at 6 p.m. To hold a public hearing to discuss districting process again, and we'll have our consultant come back and discuss the potential areas of interest, communities of interest. It'll be a similar presentation, and hopefully folks have done their homework and will have some comments about the important communities within the valley to focus on. So great, thank you.
Thank you. Good night.
Good night.
And the location of that meeting?
We'll be here. I think the city of El Centro has told us that.
Thursdays are good.
Yeah, Thursdays are okay.
We're good. So,
Great.
yeah, just, yeah,
Thank you.
we're good.
All right, and the county's been really unresponsive when we tried to use their chambers.
Yes.
And pretty much ghosted us. It's been a theme with our board apparently. So, with that, I'm gonna adjourn this meeting until the next special meeting on the 25th at 8:34 p.m.